Welcome. In this video, we're diving into Cytomegalovirus retinitis, or CMV retinitis, a serious eye infection that can lead to vision loss. We'll explore what causes it, how it affects the eye, its symptoms, diagnosis, treatment, and more. So, let's get started. CMV retinitis is caused by the cytomegalovirus, or CMV. Now, CMV is a very common virus. Many people are exposed to it at some point in their lives, often during childhood. For individuals with healthy immune systems, CMV usually causes no symptoms or only mild, flu-like symptoms. However, in people with weakened immune systems, such as those with HIV and AIDS, organ transplant recipients taking immunosuppressants, or those undergoing certain cancer treatments, CMV can reactivate or become more active, leading to opportunistic infections like CMV retinitis. So, how does CMV actually damage the eye? Well, when CMV reactivates in someone with a weakened immune system, the virus can travel to the retina, the light-sensitive tissue at the back of the eye. Once there, the virus infects the cells of the retina. This infection causes inflammation and cell death, leading to characteristic retinal lesions. These lesions can spread and coalesce, causing progressive damage to the retina. Without treatment, this damage can lead to significant vision loss, including blindness. CMV retinitis is most commonly seen in individuals with compromised immune systems. Before effective antiretroviral therapy, it was a very common complication of AIDS. While the incidence has decreased significantly with the widespread use of these therapies, it's still a concern for those who are unaware of their HIV status or those who are not effectively managed. CMV retinitis can also occur in organ transplant recipients and in individuals on immunosuppressive medications for other conditions. The symptoms of CMV retinitis can vary depending on the extent and location of the retinal damage. Common symptoms include blurred vision, floaters, those little spots or specks that drift across your field of vision, blind spots, decreased peripheral vision, and difficulty seeing colors. Some people may experience flashes of light. In severe cases, if left untreated, it can lead to significant vision loss and even blindness. It's important to seek medical attention immediately if you experience any of these symptoms, especially if you know you have a weakened immune system. Diagnosing CMV retinitis typically involves a comprehensive eye exam by an ophthalmologist. During this exam, the doctor will dilate your pupils to get a good look at your retina. They will look for the characteristic retinal lesions associated with CMV retinitis. Fluorescein angiography, a test where dye is injected into your bloodstream and photographs are taken of your retina, can also be used to assess blood vessel leakage and areas of retinal damage. In some cases, a sample of fluid from inside the eye, called a vitreous tap, may be taken to confirm the diagnosis through laboratory testing for CMV. While there aren't distinct types of CMV retinitis in the way we might classify other diseases, the presentation and severity can vary. It can range from small, peripheral lesions causing minimal symptoms to large, rapidly progressing lesions that threaten central vision. The location and extent of the retinal involvement dictate the impact on vision and influence treatment decisions. The goal of treatment for CMV retinitis is to stop the progression of the viral infection and preserve vision. This typically involves antiviral medications that specifically target CMV. These medications can be administered systemically, usually intravenously or orally. Examples include ganciclovir, valganciclovir, foscarnet, and cidofovir. In some cases, an intraocular injection of ganciclovir directly into the eye may be used to achieve high drug concentrations in the retina. It's also critical to address the underlying immune deficiency. For example, people with HIV/AIDS should be on antiretroviral therapy to improve their immune function. The duration of treatment varies, but often involves long-term maintenance therapy to prevent recurrence. Preventing CMV retinitis in at-risk individuals primarily involves managing the underlying immune deficiency. For those with HIV/AIDS, effective antiretroviral therapy is key to maintaining a strong immune system and preventing CMV reactivation. Organ transplant recipients and others on immunosuppressants should be closely monitored for signs of CMV infection, and preemptive antiviral therapy may be considered in some cases. Good hygiene practices, such as frequent hand washing, can also help reduce the risk of CMV exposure. The prognosis for CMV retinitis depends on several factors, including the severity of the infection at the time of diagnosis, the individual's immune status, and their response to treatment. With prompt and effective treatment, vision can often be preserved. However, if left untreated, CMV retinitis can lead to significant vision loss and blindness. Recurrence is also possible, especially in individuals with persistently weakened immune systems, requiring ongoing monitoring and potentially long-term maintenance therapy. Current research is focused on developing new and more effective antiviral therapies for CMV retinitis, as well as strategies to improve immune reconstitution in individuals with compromised immune systems. Studies are also exploring the potential of gene therapy and other novel approaches to treat and prevent this serious eye infection.